Welcome aboard, Dr. Dan. We're so happy that you agreed to join us today.
Yeah, thanks for having me on, Sue.
It's going to be so nice. We're going to have an expert who's going to really walk us through what's happening with psychedelic medicine, in particular with an eye towards the medicines that are in the queue. So psilocybin, MDMA, and ketamine, which is the legal one at this point. Would you mind going ahead and jumping in and do a little warm up here, get people oriented to the subject partly, say a little bit about yourself, where you are, who you are, and then a little bit about your background. You've got a really interesting story that I think will lead us right into some of these conversations.
Sure. Yeah, happy to do that. Right now I'm in Austin, Texas, back home. I'm from San Antonio and Austin.
We're neighbors.
Yeah, we're right down the road from each other. So next time we're having
right.
this conversation, it'll probably be in person.
That's right. That'd be awesome.
I just opened up my center, Kuya, Kuya, not even 3 weeks ago. It'll be 3 weeks tomorrow. And it's already been beautiful to see the community build and start. We're wanting to reform and rebirth the new kind of vision for what mental health can look like, the mental health centers can look like. So we have an excellent suite of services. We have a beautiful facility, and those two things still sit on top of the fertile, rich foundation, which is our community. And the way we've practiced mental health, psychology, psychiatry for the last many decades has been primarily in isolation. So when a person goes to see their therapist or their physician, it's usually in isolation and it's not really connected to a community. So we wanted to reform that. And so our community is really based in a transformational model where everybody is going through their own process of transformation through their own experience and through their own lens. So the community starts to be able to support itself and lift everybody up.
And when you say community, what do you mean specifically?
So we have a 10,000 square foot facility, 2,000 square feet of that are community space. And
so you mean like the Austin community or your community of clinicians or patients or?
All the above. We see clients from all over the country. And the suite of services, because we have a 20-person sauna and cold plunges and float tanks and an IV lounge and a tea and tonic bar, we have a lot of associated therapeutics that we can put around the medicine work to support the medicine work doing its job even better. And so we don't have to rely on the medicine work to do everything. And we wanted to build this around a community model. So principally around our clients and our patients coming in the door, but also around the recognition that many people who come to see us are going to come to heal a particular constellation of symptoms: depression, anxiety, PTSD, addiction, pain. And our services are very good. We have an excellent track record and we're tracking all of our data. And we want to be able to tell not only the new story of this kind of transformational medicine approach, but we want to show the data, because story moves culture, but data moves science. So when we can show the data and really showcase not only the people's transformational experience, we can say, oh yeah, on paper, it makes sense that people would be feeling better because their chronic inflammatory markers are down. Their organic etiology and cause for their longstanding depression has been identified and worked towards resolution, whether it's an adrenal issue, a thyroid issue, gut dysbiosis, immune system dysregulation, particularly in the midst of COVID, or a variety of other non-organic issues, lifestyle issues, sleep dysregulation, toxicity in the diet. These are all part of the assessment that we have to look at, because we're this really beautiful, complex biopsychosocial, spiritual machinery. And if we're only looking at the neurochemistry kind of from the standard of care psychiatric model, then we're losing the majority of the whole picture. So our suite of services is very good in regards to the healing kind of orientation when we put people through our protocols. And those same suite of services are very good for people that are also optimizing. Because if somebody doesn't necessarily have a thing that they want to quote unquote heal or fix, it's still good to do a sauna and a cold plunge and float and get IVs and optimize and be making sure that the dietary approach that you're using is good for your physiology and your constitution and in the right time of the year and the balance of your micro and macronutrients. And so all of this has the opportunity to tell a different story, which is we're all in the hairless monkey suit, going through our process of transformation, just doing it a little bit differently. And so when we can combine optimization and a healing community, then it just by osmosis allows people that have been stigmatized and labeled with chronic refractory conditions and diagnoses and illnesses that they're always going to have. It offers us the opportunity to tell a different story.
And right now, when you say IVs, what is in the IV? What's actually happening? Is it the ketamine? Is it something else?
No, we don't use ketamine in an IV administration. We do our ketamine therapy in intramuscular injections, and the majority of it, and then also some in sublingual or oral troches or rapid dissolving tablets. IV ketamine has the benefit that you can stop it. If somebody starts having a freak out or a bad trip, you can stop it. But for us as a transformational community, I'm actually curious about that. If somebody has a bad trip, that's excellent information that their stuff is right on the surface. So let's understand that further. Let's create an opportunity with the right set and setting, with excellent facilitation, to recontextualize a person's ability to lean into that thing that's most uncomfortable, because there's so much opportunity for growth there, as you know.
Totally. It gets into like the mechanism for healing, that there's such great results that are coming out of this. As a matter of fact, sometimes I get worried that it all sounds so, people can become almost evangelical about it. Like it's everyone put it in the water. And I worry about that. As a group therapist, I'm always, if there's only one note being hit, probably something's being missed. However, there are really fantastic numbers and effectiveness being shown with these medicines. And I am curious because they're all a little different. And what is your sense? I actually want to get into the details of the different psychedelics.
Yeah.
Yes. Cool. And to understand, first of all, say you have one person and they have a choice of the different psychedelics. It's what should they be considering? How do you see them used differently? Mm-hmm. And then also just in general. So you have, say, the medicines, and then what are the populations that you feel like each one speaks to? And I really want to understand how does this work? How is this so effective?
Yeah. Yeah. So happy to talk about
a couple of questions there.
I'll wrap up to this point so that we have a more continued conversation. I don't leave any like open tabs, so to speak, or open browser windows. So you heard about my history.
Yes.
So I've had a long history of intermittent depression. I was probably kindled for that. There's a long history of depression in my family, suicide, real intense dysregulation. And that layered on top of a half a dozen really severe concussions throughout snowboarding and soccer and diving and breaking my neck and a whole lot of different things. I had an organic etiology as well. And no one that I saw, even through all my medical training, I got into psychiatry and neurology just because I was really fascinated by the fields. And I was in my neurology training when I had my fifth concussion. No, my sixth concussion. My fifth one was when I broke my neck. That was 3 weeks before medical school started. So I started med school in a big halo, which was an awesome orientation to get into psychiatry and neurology. And then later, a few years later, in my neurology training, I had my last concussion. And I knew, because of the way I hit, I knew it was bad. I put an 8-inch crack in my helmet. There was this internal voice said, "You just crossed the line." I was like, well, that didn't sound so good. And sure enough, over the coming weeks and months, I started having really severe post-concussive syndrome. And I asked my neurology attending physicians, I said, I just got pretty wrecked. And now my sleep is dysregulated. My mood is dysregulated. I can't think. I feel like I'm thinking through mud. My attention, focus, concentration, short-term memory, shifting sets, all of that was, my executive function was really lousy. And they all said the same thing. They said, yeah, you had a concussion. You have post-concussive syndrome. Go home, get some rest. We hope it gets better. I'm like, that's all you got? Mm-hmm. Wow. Okay. So obviously we have excellent diagnostics and really shitty therapeutics. And so I got in the lab and I wanted to understand neurorehabilitation. And then that kind of dovetailed with my work with ayahuasca. And it was the first time that I really felt my brain come online. So I closed up my clinic at the time, moved down to the jungle, lived in the jungle for a year, apprenticing with ayahuasca. So I have this understanding and appreciation of the hardware sciences and neurology, and the software sciences, psychology. And that's essentially what we built at Kuya, as a transformational medicine center where we bring both together, the hardware and the software. So then to answer your last question about IVs, So the IV therapeutics that we offer are vitamin mineral cocktails, peptide therapies. We were working with exosomes and stem cells, particularly for people who have concussive issues and need more of that neurorehabilitation and the accelerated scaffolding for neurologic repair. But the FDA has cracked down on biologics, and that includes exosomes and stem cells. So you can think of stem cells as like seeds for new growth. They really support regenesis. And exosomes are like the fertilizer for that growth. They're signal messengers. But anyway, so we can't do that as much. But what we do is we use all the therapeutics that are appreciated in the space to be regenerative performance tools. And we put that around a person's experience of where they are, orienting to the goals that they have. And if they're coming from a healing community, then largely they're going to be desiring to heal from a variety of conditions. And if there, again, is an organic etiology, I also have historically had chronic cytomegalovirus and Epstein-Barr virus. My titers have been really high. If I'm stressed and I've done a lot of travel, or it's in the winter months and I'm not getting as much vitamin D. And when those titers flare, I know I have a higher predilection towards depression. We know those two chronic viral infections lead to chronic severe depression. So this is just an example. And because of how I hit when I dove off a pier and hit a sandbar, and essentially I broke C5 and I was totally upside down. So my brain just smashed into my skull plate, and kind of vice versa too. So what happens then is you have pituitary dysregulation, and you have an issue that looks like primary hypopituitarism, because the primary injury is in the pituitary gland, but it looks like hypothyroidism, low adrenal glands, and like low testosterone. All of that, if you're just looking at the labs and you're not looking at the brain, you're going to be like, oh, all these hormones are low. Let's give you hormones. That's not the issue. Like, the glands are fine. The brain just can't tell those peripheral glands how to work. So you actually have to repair the brain at the central axis. So not to get too complicated, but just an example of where we're going in medicine, which is the appreciation that we're this integrated system. And you have to be you can't separate the mind from the brain, just like you can't separate the person from the environment. Gabor Mate, like legendary quote. And it's true. So we have to understand the complexity of the human organism. And that includes looking at our brains, doing brain map systems, and taking really good history and physical exams, and understanding that. Also, there's a great article in Forbes magazine I was just reading, I think it was launched today, about the reformation of the entire mental health system. And I don't know that we need the entire reformation, because again, it's hardware and software together. But what they're saying is, like, maybe many of our what we call mental illnesses aren't illnesses at all. They're just adaptive responses. And I think there's a lot of truth there. Like, depression can be an adaptive response. Anxiety can be an adaptive response, especially when we understand what the core issue is, the core wound or the core trigger. That's where medicine comes in.